Three. Hey guys, it's Steph and Carrie. Thanks for tuning in to another episode of The Alternate View. Tonight we're going to be discussing a research that was put out by John Hopkins University talking about death rate tolls since 2016. So not just inclusive of COVID, but all death rates.
Mm-hmm. Right. So this is an article straight from a professor at John Hopkins University. She was a professor of economics. Her name is Genevieve. Let me make sure I get it right. Genevieve Brand. She took the information from the CDC on the death rates from 2016 through 2020 to see if there was any difference in the death rates from the years previous to 2020 and the death rates in 2020 because of COVID. Her hypothesis was that the death rates in 2020 would be much higher because of all the deaths from COVID. But interestingly enough, what she actually found was that there was very little difference in the death rates. I think it was something like around 11,000 higher in 2020 than in the previous years.
Wow.
And so very low. And she said
Which makes sense.
Yeah, she said that number is statistically insignificant because she said that was just specifically related to population growth. But what she said was she found something very interesting. She found that the death rates for the diseases that were the top killers in America had decreased drastically, but that the death rate from COVID had increased. So what that means is heart disease, I think she said respiratory illness, things like diabetes and cancer had drastically dropped.
Right.
And what she said was that the statistics were misleading because if COVID was truly the killer that they were saying it was, the death rates for 2020 should have been much higher, and the death rate for heart disease would have still remained at number one or close to number one. It wouldn't. The other thing was the flu and pneumonia. Those were the other things on her list. Said that the death rates for COVID would have also spiked, but those would have remained relatively the same. So she said that the information that's related to COVID is being misrepresented.
And that makes total sense because if you think about what the CDC came out with a few months ago, they were saying that the people that purely died from COVID is really only, I think it was 6 or 9% of the total deaths that they were informing us about, which came to about 9 or 10,000 deaths total. So that kind of coincides with the research that she just put out.
Exactly. So
makes sense.
It was 6%, and it hovers right around 10,000.
Right.
And what she is suggesting, well, there's even more interesting news. What she was suggesting is that these people are dying from things like heart disease and diabetes, respiratory illnesses, the flu, and pneumonia, and it's actually being classified as COVID, which goes along with the CDC statistics that said that people are over 80 in nursing homes and have 2 to 3 plus chronic illnesses. But interestingly enough, Steph, she actually ended up taking the article down. The article was removed a couple days later, and she was interviewed and they asked her why she took it down. And she said that she 100% stands behind the information that she gave.
Okay.
But that, get this, it's too divisive. So code speak, by the way, for my job was threatened. I mean, I don't know if that's really true. I can't look behind the scenes, and I know you're going, but I will tell you, I have been in the academic field for almost 15 years. And I can tell you that when a professor doesn't do something that the institution likes, they get threatened. I've seen it numerous times. I've seen it happen over and over and over, probably to a good handful of people. Well, I've been a student as well as teaching at colleges.
So you don't think she got approval for that article?
Well, the thing is she actually, so I don't know. I know they said it came out as an article, but I don't think it came out like as a peer reviewed article. And
Okay.
But there is a video of her doing a lecture to her students on it, and that was removed as well.
Wow.
So, I mean, granted, I can only hypothesize that that's the case, but I can tell you that I've seen it happen before, so I would not be surprised.
And what about the people that we've personally heard through someone else that has either died of a car crash or through suicide, and their certificates also said COVID? I mean, that
Well,
goes into the same tally.
yeah, if you looked at the CDC statistics, I think it was around 6,000, 7,000 people who had died from things like suicide, homicide, motorcycle accidents, poisoning, which clearly are not COVID deaths, who were actually classified as a COVID death.
Right.
And I had a friend tell me that a family member died from something like that. I can't remember exactly what it was, but she said that they're actually fighting with the insurance company. I'm sorry, they're fighting with the hospital because the insurance company won't pay for it because they don't.
Wow.
They're saying it's not a COVID death, which makes sense.
And they're also getting a kickback for every COVID patient that they had, especially
Exactly.
if they were on a ventilator.
Yeah, exactly. So what I've heard, and this was a while back, and I it was just through the grapevine, but what I was hearing was they get like in like the 10 to 15,000s for somebody who's diagnosed with COVID, and something like 70,000. Did you hear that?
75,000 if you're on a ventilator.
Oh, no. It's 70,000 if you die of COVID. It's like in the teens if you're diagnosed with COVID, something if you're on a ventilator, that's somewhere in between, and then $70,000 from Medicaid for the hospitals.
Why such a large number? Why are they being paid for a death?
That I don't answer to. I don't have an answer to. I don't know what the reason for, but it clearly gives them great incentive and kickbacks. Absolutely. But there was a lot of anecdotal evidence, like stories coming out from nurses crying and doctors for that matter, who were very upset, saying that people were just being allowed to die on ventilators.
Right.
Yeah. So terrible. I mean, granted, there was clearly no medical study that was suggesting this, but nurses and doctors were coming out and you have to take interest.
And I do understand that in the beginning, we didn't know what was going on. The doctors didn't really know much about this virus. So I kind of get the confusion in the beginning. But even now, with the point that they have the vaccine set and ready to go, why do they keep telling us then that every day we're learning something new? If we're still learning new things about this virus, how could we possibly have a vaccine to prevent it and cure it?
True.
We're still learning.
Exactly. And the interesting thing I think about this vaccine is the fact that they're putting out this vaccine for a virus that has 0.25% death rate.
Right.
And they're trying to say 75, 80. I mean, first they were trying to say 100% of people needed to get this thing. If 100%,
now they're saying 85.
They said 75 to 85 in the interview with Dr. Fauci. But it was Dr. Fauci and who was it? Mark Zuckerberg.
Yes.
And they were talking about, so then Mark Zuckerberg later asks Dr. Fauci, like, is this going to create immunity?
Right.
And Dr. Fauci said, what did he say? When you don't know,
you don't know, you don't know.
What you don't know, you don't know. Right. And to me, there was a Q&A where somebody asked, and I know we've actually already said this in another video, but it still, makes sense to bring it back up, where they said that this vaccine is actually not going to create any immunity. So it'll just lessen your symptoms. So you'll still have to wear a mask and you'll still social distance. We'll have to social distance.
But if you think about it, you can't become immune to a virus. We don't become immune to the flu or a cold. Those are all virus strains.
Yeah,
There's no such thing.
At least not long term, certainly. I mean, and there's definitely evidence to point to the fact that the vaccine companies are getting, we all know the vaccine companies are getting a huge payout from this, but there's research to show that these vaccine companies have great interests in our national health institutes, like National Institute of Health and the CDC, where they're giving them huge amounts of money.
Right.
in order to do research. And I think Stephanie and I will do a video on that another time, but there's huge incentive for them to say this vaccine's a good thing and this vaccine works, because if they don't do that, the pharmaceutical company who funds a lot of their research probably isn't going to give them money anymore.
Bail out. And not only that, they need to recoup their money. How many billions of dollars, I'm not sure exactly the amount, was pumped into the research for this?
Exactly. Well, I do know that the United States pledged $9 billion to 5 pharmaceutical companies. Almost $2 billion of that went to Pfizer alone. But the interesting thing about it is, Steph, is that Pfizer will not get paid that amount of money until the vaccine is ready and delivered.
Right.
And not to mention, when the vaccine does come along, they're saying, oh, we're giving it to Americans for free. But the truth is, they're not giving it to us for free. Our tax dollars are paying for it, you know? So let's say that the vaccine is $100 per person.
Right.
And even half of the world gets vaccinated, which is 375 million people.
Right.
That is, wait, no, I'm sorry. Is that right? Is that right? No, I'm sorry. 3.75 billion people.
They're going to make $375 trillion.
Billion dollars. $375 billion they will make off of one COVID
on half of the population. Only on half of the
population. And the thing is, there's a booster, and most likely this will be a yearly thing. So they have a hell of a lot to lose. But interestingly enough, there's a lot of other doctors who are coming out and saying that this vaccine is very, like, it's very dangerous and we shouldn't be using it. One of the doctors is actually, I'm pulling up my information, so sorry if you see me looking down, but is the director of public health in Wyoming. And he's a medical doctor. He's Russian. His name is Dr. Igor Shepard. He was actually, before he came to America, he was actually in the armed forces in Russia. And he said that he worked on biowarfare in Russia. And what he said was the vaccine looks a lot like some of the bioweapons that they developed in Russia.
Crazy.
Yeah, he says it's dangerous and that we should not get it. That it's scary to him. He said it's very scary. There was another doctor. Let me pull it up. Give me a minute.
And these are all published articles?
No, he's actually on record, like in an interview, stating these things. It's not an article, but he does an interview and he talks about this, how it looks like a bioweapon to him, specifically the RNA vaccine.
Yeah, that's very concerning.
Yeah. There's another doctor. I'm going to read this quote to you because I don't want to get it wrong. His name is Dr. Sukrit Bhakti. He is the emeritus of Johannes Gutenberg University in Mainz and a longtime director of the University of Medical Microbiology. He says that this vaccine is downright dangerous. And I quote, he says, "I warn you, if you go along these lines, you are going to your doom." And it is so unnecessary. He said that he doesn't understand how Dr. Fauci is coming up with the information that he's coming up with. And he said that he would go up against him any time and tell him wrong.
I hope he does it. I hope he does it.
Me too.
That's so scary.
It's very scary. I mean, there's rumors going around that this vaccine sterilizes. That somebody said a whistleblower. That hasn't been substantiated. That wasn't something that I could find information on, but I've heard that. There's just and we said last week, we talked about that former vice president of Pfizer, who was quoted saying that not very many people are going to need this vaccine because COVID is far less serious than they believed that it would be in the beginning. But yet they're still pushing this 75
for everyone, especially children. That's a huge concern because they're the ones who really don't need it.
Yeah, they were saying something along the lines of get it for grandma and grandpa so you don't kill them. So they're like playing to your heartstrings,
Yep.
making you feel like if you don't. But what's really interesting is in a Q&A, they said that this virus does, I mean, this vaccine doesn't even cause immunity. In fact, all
Right.
it does is lessen your symptoms. So wouldn't it be more dangerous to get this vaccine
Yep.
and be, what's the term they keep using? Asymptomatic, go
Right.
out virus when you're asymptomatic. You're way more likely to bring it to grandma and grandpa when you're asymptomatic.
I agree.
Mm-hmm.
And think about if it's on the schedule, how many people are going to be getting it year after year? So
Exactly.
is there a buildup? I'm sure there's a buildup,
Mm-hmm.
you know,
And
effects
you
of this,
absolutely.
not just the
And
initial shot.
here's how I look at it, Steph. If you want to go out, and I don't mean you, but you understand, I mean people in general. If you want to go out and you want to get this vaccine, go ahead. That's totally fine. Don't make it mandatory for the rest of us who don't want to get it.
That's like all vaccines. That's how I feel about all of them.
Absolutely. And the same with masks too. I
Yep.
mean, if you want to wear a mask, I was talking to a friend. I love her dearly. She's a wonderful, wonderful girl. And she says she wears it because if she can save a life, she wants to be able to do that. And I explained to her that the reason, oh, that amazing video, the reason that I don't wear it is because I feel like wearing the mask is condoning the behavior that's being set forth. I mean, when you research Russian communism, you research Chinese communism, you research the Holocaust,
Mm-hmm.
you see that the things that they are using, like the scare tactics for COVID, the separating us,
Yep.
the no longer allowing people to talk, their faces are covered, they're dehumanizing us.
Yep.
The bringing down the propaganda, not allowing the other voices to be heard, calling these people who are, I mean, professors and public health officials, like people who have a lot of information and are very knowledgeable, or
And have no reason to lie.
exactly, being called conspiracy theorists. This is exactly what it looked like for the fall of all of those countries, as well as for the Holocaust. Straight up propaganda.
Right. I was watching something earlier. It was on the video of a restaurant in Canada, surrounded by police officers, not letting anyone in the building because they were supposed to be shut down.
Mm-hmm.
And under it, someone had written a comment about the masks and how this is just a symbol. And that's what I've felt
Mm-hmm.
and seen all along. And that's why I refuse to wear the mask,
Mm-hmm.
because it's not the physical being of the mask, it's what it
Mm-hmm.
represents, it's what we are complying to. It's showing that, you know, we're not going to take a stand. And if they know we're not going to take a stand, they know that they can control us however they want. A mask is just the start of it. Then it will be a vaccine.
Mm-hmm.
The list will go on and on.
Absolutely.
And that's why I refuse.
Mm-hmm.
And that's why I wish more people would just simply take it off. Yet they're being cowards about it, and they don't want to rock the boat. If you're not willing to rock the boat for this, what are you willing to rock the boat about? It's going to be a lot harder to cover your arm when they want to inject you than it is to simply take off a mask.
Mm-hmm. Exactly. I feel the same way.
Right. So the question is, how are we going to get enough people to stand up and fight back?
Well, you and I are going to
We're unable to.
continue to do, you know, what we're doing. But I think you bring about the good point of this is when we need to be speaking up. This is when we need to be doing something. Yep. If we don't want America to fall, it's time that we start saying things.
Exactly.
And Stephanie, you were talking about. Go ahead.
There's one point I want to make before you switch. You and I have been talking about when a good time to start standing up would be. And we had always felt if we had done this earlier, it would have been possibly too soon. I mean, 1 month into this, too soon. Now it's almost becoming to the point of too late. It's now or never.
Well, you also have continually made the points that if these masks actually work, like just thinking back to the hotel thing,
Yes.
the restaurant thing, the
Yes.
restaurant surrounded by the police, that if these masks actually work, then why can't we go out in public? Why do we have to social distance?
And I also saw some graphs, and this would be a great one to talk about in another episode.
Mm,
It was about 10 countries around the world, and it showed a map of all the months and when they peaked, when there was a spike in COVID.
mhm.
And these countries were all wearing masks throughout this whole entire time. For each country, there was about 3 or 4 months where everyone was wearing a mask, and then there was a spike. So if these masks work, why was there a spike at all? Everyone had been complying for months.
Mhm. There was actually a Danish study that recently came
Hmm.
out. And I don't know the exact statistics, but I vaguely remember them from reading it. It was something like 6,000 people were tested. Some were put into a control group where they didn't wear a mask, and then the others were put into a group where they did wear the mask.
Hmm.
And they found that there was no statistical significance between wearing a mask and not getting COVID versus not wearing a mask and getting COVID. And what they said is they actually took out, they took out the people who admitted that they weren't wearing the masks, who were supposed to be in the mask group, just to make sure that they didn't have any people who were skewing
Right,
the data. They showed that masks make no difference.
right. And if you think about it, they say that 80% of the people that have come down with COVID were wearing masks.
Yeah, that's
So,
true.
and
That's true.
and again, and we've talked about this before, not everyone has been fitted for a proper mask. If there was a mask that was, shown to be working against viruses, that would be fine. But they don't care if you put a piece of toilet paper on your face as long as it's covered. But it's
That's true.
true.
It's true.
It's
Well,
true.
we'll talk about the thing that you posted about the receptacles for masks.
Right. So if this virus is so deadly and so contagious, how come we're seeing them on park benches, on the ground, not in trash cans, not in biohazard containers? And I don't want to hear the argument that it costs too much money to put those things out, because how much money does it cost to put signs and plexiglass and stickers on the floor to tell us to social distance?
Mhm,
That's a lot of money. You're doing
mhm,
that in every single store
mhm.
globally,
Yeah, put a
and in public places.
exactly. Put a trash can with a lid to stick the mask down in it, and the
It's
gloves for that
disgusting.
virus is so dangerous. Why don't we have those things available?
So
Another.
when we're at the park with our kids and they're trying to pick it up because they don't know any better, that's
Mhm,
disgusting.
mhm. Absolutely, and
I mean,
I
it's also the people's fault. Come on, grow up.
oh,
Don't trash the planet.
but let's not even get into that right now. Why aren't there these bins? And I think we need to
Right.
leave that. And the last thing that I want to say before we end is,
Hmm.
and I think I have said this before, but once again, I think we need to reiterate it. Stephanie and I are the type of people that safety is very important to us. My son's school, I guess it was the end of 2019, or the middle of 2019 when we shut down. 100 kids were out sick, and we were asking, why aren't you shutting the school down? Why aren't you shutting the school down? And they didn't have an answer for us. Like the principal, I asked her, why aren't we shutting the school down? She
Right.
didn't have an answer for me. So if we're not going to shut the school down when 100 kids are sick, a little boy who had breathing issues probably had COVID, because we've now found out that it's common,
Exactly.
came in December, had to be rushed to the emergency room for treatment, but we still weren't shutting the schools down then.
You know why?
So
Because it wasn't even thought that we would do
what
something so ludicrous.
Yeah,
Unless we're
exactly.
told by government officials, it's so far-fetched and crazy that we would do such a thing like that. That's
Mhm,
why. But now that
mhm.
the government officials tell us we need to do something for our health, it's
Hook,
okay.
line, sinker. Yeah,
And
exactly.
I'm tired of the government telling us what we need to do for our health. They have
Mhm.
not even ever seen me in their life.
And not even that. I mean, if they really truly cared about our health, wouldn't they be taking the chemicals out of our food, banning Roundup, banning all of these chemicals that are truly terrible
Proven to
for our
be
body?
carcinogens?
Carcinogens, exactly. Um, it just it doesn't make sense.
No. Nope.
Do you think we're at an end?
For tonight?
Yeah, is there anything that we want to say to wrap up?
I just think people really need to start opening their eyes, doing their research, using their common sense.
And just
And
remember, we're we the people. I'm sorry to cut you off, Steph, but one thing I've noticed is that people forget that we are in charge of the government. There's always this idea of there's nothing we can do.
yep.
No, there is something we can do.
Yep.
Our founding fathers wrote the Constitution so
Yep.
that we, the people, are in charge, not the government.
It's so funny you just said that, because before we started tonight, I posted that video of the police surrounding the Canadian restaurant, and I said, I don't want to hear anymore that we can't do anything, because unless you're okay with this happening, can't say that.
And that's
can't.
true. I don't know what the rules are in Canada, but I do know here, under the Constitution, we, the people, are in charge. Stop allowing the government to tell us what to do.
Right.
Let's take our country back.
Right. Well
Time
said.
to stop the masks.
Yes. It's been way over time.
Time to get out of lockdown. Time to demand our kids go back to school.
Yep.
Time to tell Dr. Fauci to get out.
Exactly. Exactly. But people refuse to do the simplest of things.
Ooh, and stand up to election fraud. Let's just do that one really quickly. Stephanie and I have been lifelong Democrats. Since we were 18 years old, that's been about 20 years, we voted democratically. We have both thought that Trump was not the greatest guy. Like, we were nervous, but 4 years ago we were crying.
You were crying on the day that he got elected.
Exactly. We were freaking out. But here's the deal. I'm not going to say if election fraud happens, we should care much more about the democracy of our nation and having a vote that counts, because if our vote doesn't count, we no longer have a democracy. Then who's president? If the people spoke and Donald Trump is the true president, truth, righteousness, and justice are way more important than having Biden as the president. So no matter what side you're on, Democrat or Republican, stand up to the fact that there was voter fraud and demand that they look into it. Demand that the FBI, the CIA, the attorneys, they all need to look into it.
Look beyond Trump. Look beyond Trump, whether you hate him or not.
And one of the things Stephanie and I always say is, if you had a neurosurgeon who was a jerk, you had something that you needed to be operated on, a neurosurgeon, he's a jerk, but you know that he's a really good neurosurgeon, who cares? If he does the job right, who cares what his personality is? Try to see beyond that. Yes, Biden is a kind, caring man. That doesn't mean that he's going to do a good job good job running our country. Right. Trump may be a bumbling buffoon, but that doesn't mean he's actually done a bad job looking at our country. Look beyond the person.
Yep. Well said.
That's all I have to say.
Well said.
Thank you.
Well, I think we will wrap up tonight. Definitely a good topic. Important information. We have lots more to talk about, of course.
We do. Maybe at some point we do something that's not related to this, but I think we do need to do some stuff on like the election, and also talk more about like how much incentive the pharmaceutical companies have to get a vaccine out.
Yes, absolutely.
All right,
guys. Thanks for tuning in. We'll see you on the next episode.
Have a good night.
Bye.